Good morning, everyone. Today is November 19th. I took the day off at work, so it's about almost 9 a.m. I have to rush out because I'm about to meet with my brother-in-law. I'm gonna call him my brother-in-law because his wife is like a sister to me. So I'm going to be, he's a doctor, so I'm going to kind of be sort of interviewing him / vlogging. We kind of had a brief conversation over text message about microneedling and how it's beneficial, like upkeeping of your skincare. So I have to drive out there. So let me head out. Come on, guys, let's go. So I'm here now at the clinic of the place where I'm going to be vlogging the model. It's sitting right there. This is the Dr. Yinka. Anyway, so this is what this place looks like and where the procedure is going to be taking place. And I'm going to have Dr. Yinka talk to us briefly about what we are about to watch. And he's also going to tell us about the benefits of it and himself, a little bit about himself.
Hello.
Hello, how are you?
I'm good, and you?
I'm all right.
Okay.
I called you my brother-in-law earlier, so I figured might as well.
That's fine.
Good to see you.
Yeah, good to see you as well.
All right, so please tell us a little bit about yourself and what we're here to learn about.
Okay, my name is Yinka. I'm a nurse practitioner. I've been a nurse practitioner in the last 3 years. Prior to that, I worked as a registered nurse in different settings. Today, we'll be talking about microneedling. Apart from being a nurse practitioner, I also focus on things like human tissue therapy, regenerative therapies, for pain management and also for aesthetic.
What kind of ailment does someone have for them to get the
regenerative therapy?
Yeah.
So that focuses mostly on pain, joint pain especially.
Okay.
Knees, elbows, shoulders, back pain, spinal injuries, and things like that. For long-term management, we believe that the human tissue therapy, which is the regenerative therapy, helps longer.
Long-term.
Long-term, it helps with healing, and it helps to regenerate those cells.
Okay.
Regenerative therapy can also be used for aesthetics, and that includes hair loss treatment, facial wrinkles, scars. So those are also the use of microneedling as well as PRP. We call it collagen induction therapy because it helps regenerate collagen in our system. The benefit is that we are using your own body to regenerate itself instead of doing surgical procedures.
So you're pretty much using the blood after it's been processed?
So yeah, so for PRP, we use the patient's own blood.
Okay.
All we do is take your own blood, we put it into the centrifuge, and we're able to draw out the platelets from your own blood and re-inject back into where there is injury.
Okay, great. Thanks for that. All right, guys. So the doctor is about to talk to us about what this is. It's called SKINPEN Precision, and he's going to tell us what it's about.
When it comes to the SKINPEN, it's you require a medical license to get this. So this is what it looks like.
Okay.
So this is specifically useful because it is FDA approved.
Oh yeah, it does say it right there, guys. See? The first FDA cleared microneedling device, 100% designed, engineered, and made in the USA.
I like made in the USA products.
Right?
But anyway, so this is useful, like I said, because it's FDA approved and it's one of the best in the market. So what we use the SKINPEN for primarily is for facials, neck, on your neck as well. So we create microneedle, which means we are creating specific injuries, micro injuries in locations where it has been applied.
Okay.
What that does is to bring the collagen out. And so, for example, if a patient is here for facials, which we're going to do today anyway, create those injuries on the surface, and we combine that with PRP. Okay. We can also combine it with serum, which has growth factors in it, and that helps to smoothen the skin, makes it firmer and smoother.
Okay. And how many procedures do you need before you can maintain it by yourself at home?
So we recommend 3 to 4 treatments.
Okay.
And that it's going to be 3 to 4 weeks apart. So if you have one today, we recommend you come back in 3 to 4 weeks to see us.
Yeah.
Up to 4 times.
Okay.
So that will be especially useful.
Yeah, I'm feeling fine. I get products.
Okay.
Products are always good.
Yes, it is. Say that one more time.
I said I'll have to come back for the other treatments. They recommended what, 3, 4?
3, at least
3?
3.
Okay,
At least
yeah.
3.
Yeah,
Awesome.
so I'm definitely going to, I want to see the full benefit.
Yeah.
So I'll definitely come back.
You're already feeling it.
Yeah.
Because on your face, you feel tight.
It feels really tight, yeah, so.
Awesome.
Okay. All right.
Bye.
Bye.
Thank you.
All types of patients, no matter what their concerns are. But it's a great, we call it kind of the gateway treatment, the gateway drug into skincare, because a lot of people have had facials, microderms, chemical peels. This is going to be that next step.
Oh,
There's no
really?
downtime.
Okay.
And, you've got, pull out the big guns, the big lasers, $1,000, $1,500 pop. That's a big investment for people.
Yeah.
So this is far more economical. It yields great results. It's the treatment patients will continue to come back in for because it yields such good results. I was not employed or paid by SKINPEN. I've worked with every microneedling device on the market. Once this one was out and received its FDA approval in 2018, the doctor I worked for brought this on. And I had horrible acne scars. I was on Accutane 3 times. So that's how I initially got in the industry. So it's like, I think it yields better results than lasers for acne scars. I've gotten great results from it, but I've done pretty much anything and everything as I've been in the industry so long.
Bye. So, how do you feel about this, the whole training?
I think it went well. It was awesome.
Okay.
People just need to be aware of the whole procedure.
Yeah.
It's safe. You're using your own system if you decide to go with the PRP. So that's your own blood and no side effects or after effects. So
awesome. I'm gonna put your information in the description box of this video.
Okay.
So that anyone that needs or is interested in contacting you or like getting this procedure done, they can contact you through either your website, your email, or probably your phone number, whichever number.
That's great. And we do have specials. So
okay, yeah. Okay, thank you.
Thank you.